My name is Pat McBride, as Kyle said. We're glad to show you the medical school. Let me just say that I agree with what Kyle said. This is a really big challenge, big frontier all of you are on. As I tell our students many times, we're counting on you to help us figure out the solution. We didn't get it figured out. I've been doing medicine for 31 years, working with medical students for 31 years, and we've been wrestling with a lot of these concepts, but it's not just going to come from medical students and doctors. The whole country has to make some really, really big decisions. Just to give you an overview, and Dr. Remington's going to talk about this, I heard a talk by Malcolm Gladwell last year. You guys know him from Blink and those kinds of things. He's a visionary. And he said in Canada, where he's from, people decided a long time ago that you can't have it all, that they had to sacrifice something. So they made a decision to sacrifice some quality for access. He said America would never do that. We're not willing to sacrifice anything. So that's what you really, really have to think about. But first of all, I think it's really important that you get into medical school and deal with priorities first. So I can tell you in my role as Dean of Students over the last year, I'm responsible for monitoring the academic and professional progress of our students. I'm not on the admissions committee. I work with them, but I'm not on it. So you can't send me a note later asking me to help you get in, because I won't be able to help you. But I can tell you that it's a really tough job. Every medical school, our medical school, for example, gets 3,500 applications for 175 positions. So they got to comb through over 3,000 applications to try to get our class. And I can tell you that I know every year we turn away really, really good people. And every year, those people will try again. The people that are persistent, have a good chance. But what I deal with is once our students get there, how are they going to succeed? And I want to talk to you a little bit about that. And it's the kind of things that you can start doing right now. And it's really, really important. I remember as a parent going around with my kids who are grown. We went to colleges, and they'd say to the parents, they'd say, look, if you look at their schedule, these guys are going to be in class 3 or maybe 4 hours a day. And they've moved out of your house, and they're on this campus. What are they going to do with that time? And so I'll suggest to you that how good you are at prioritizing and time management and how well you prepared coming into medical school make a really, really big difference. So let me get started and tell you what's going on. So we're blessed, we're fortunate here that the people of Wisconsin have been very generous with these facilities. So we have a great place. Kyle asked me to say a little bit about our school. We just celebrated our 100th anniversary a couple of years ago. It's a great medical school. It's a major research institution. This campus usually is about number 3 in the world in research funding, and the medical school makes up about 28% of that. And I don't think there are better facilities in the country. In this block alone, surrounding block here, we have over $1 billion worth of new construction in the last 7 years. So it's an extraordinary place. Most of that was donated by the people of Wisconsin. So we're very, very fortunate. So the first thing that I would tell you is that when I started this job as Associate Dean for Students, I started working with my staff, and we'd have a student that was struggling. They'd say to me, that person doesn't really want to be here. And I said, well, that's ridiculous. I'm sure they want to be here. They applied. They went through all this training, all this preparation. Of course they want to be here. And then as we evolved and the person's progress didn't get any better, we'd realize a lot of people don't want to be here. So one thing that's really, really, really important is that you make sure that this is what you want. Because I can tell you, I meet a lot of students who want to do this because it sounds cool. They want to do it because their uncle's a surgeon and he said you should go to medical school. A lot of them don't want to be here. I don't even know that they stop and realize they're on such a treadmill about I got to get organic and I got to do this and I got to get my application. You better look at this career and the kind of challenges that Kyle put in front of you and decide if you're ready for this challenge, because it's really, really, really hard. It's really hard, and it ought to be, because I can tell you my wife was in a bad accident this summer, on a bike accident, and we came here, and she was on the trauma service, and during her care, I had 5 former students involved in her care, and they did a spectacular job. And I'll also tell you that all 5 were female, which is really interesting. And they did a spectacular job. And I can tell you, I was looking at them, and if they're going to cut my wife open, they better be good. And so our commitment to our students here is that when you graduate from here, you'll be a high-quality physician. But you got a lot of hoops to get through to graduate because you're going to be taking care of us, and that we really expect the best. Okay, so that's a challenge. So one thing you really need to think about is, are you ready to come and do all the work? Because, while I was in medical school, I had friends opening restaurants and going into real estate and doing great and had years of income before I got a paycheck. But I wouldn't trade this for anything in the world. So you got to make sure you're ready for the number of years, the amount of work, the sacrifices you make. It's a big deal. So, as you may or may not know, it's not just about medical school. Residencies last anywhere from 3 to 9 years. So cardiac surgeons and neurosurgeons are going to be in training for 9 years. A lot of people do fellowships. Some of those are relatively well compensated, $50,000 a year or so. But it's hard work. It's unbelievably long hours. It's 80-hour work weeks plus, so that's a sacrifice that you really need to make. And it's not just about you. The people that you're in relationships with, partners, family, they got to be willing to make some of the same sacrifices. This afternoon I was sitting in my office and I talked with a student who formerly was a professional in another career, came back to medical school. He's got 2 kids, third one's on the way. And his wife is making a lot of sacrifices so he can go back to school. And so they're sacrificing income. He's going into debt. He's limiting his time with his children. Big deal. So I want to make sure that you really understand it. But when you get there, like the commercial says, it's priceless. So I have people in my office every day who recognize what value they have in their physician. I got an email from a patient today who I described and taught her some things, and she said, I can't tell you how much time I appreciate what you're doing, how you're educating me. I really feel like I'm comfortable with where I'm going with my disease process. That's priceless. You really can't replace that. So there's a lot of value, but it takes a lot. So one thing that's really important is that you start thinking about expenses. Now, a lot of you already had to do that with college because it's certainly not cheap either. But this is a public university, just for example, and we're somewhere in the 20s in terms of overall cost for our education here. So the actual expenses for a medical student in our school, just as an example, are about $35,000 to $45,000 a year for an in-state student, and exceeding $55,000 or $60,000 a year for an out-of-state student. So you really got to think about how am I going to value my financial planning as I go through school. Now, if you go to other schools, private schools and things like that, it can be far greater than that. The average medical student graduates with about $160,000 in debt. And the payments over a 10-year period using interest, $160,000 translate to about $330,000, and the payments are $2,000 a month for 10 years to pay off that debt. So it's a big deal. So be thinking about how you think about managing your budget. The biggest thing I think that you can do now is be really prepared. So I get students that sometimes are out 8, 10 years. Some do post-bac, some don't. Some take other degrees. So when you enter into medical school, I'll show you our curriculum in a minute. This is pretty standard. I mean, schools have different models and different designs, but you're going to take biochemistry and you're going to take genetics and you're going to take population medicine and anatomy and physiology and all these, right? And you better be ready for those because they hit you like a freight train. I mean, it's a big deal. You're taking basically the equivalent of 21 credits a semester. And I remember when I went to University of Wisconsin-Milwaukee, I'd take organic chemistry and physiology, and then I'd take history of science and physical education. I try to balance my schedule. All 21 credits here are really tough. They're going to be the toughest courses. This guy in my office that already went through one professional school and he's back for another one, he told me the cardiovascular course is the toughest course he's ever taken in all his college career. So these things are tough, and they got to be. I mean, our module for cardiology is 660 pages, for a 4-credit course, delivered over 4 weeks. So you're going to be booking it. So come in ready. Take courses now that really get you in the mode so that they're not so hard. This is a bit of what our curriculum looks like. It's a simplistic view of it, but you're going to take these basic courses when you come. some of our students come, and especially if they've been at a campus like Madison, they think, well, this pretty much looks like what I took as an undergrad, you know. It ain't undergrad. I can tell you it's not. It's a whole another level of detail, volume. It's hard work. And so they think, hey, I can hang out at the football games and do all that stuff like an undergrad. No, you can't. You know, you're going to sacrifice. It's going to be different. It was really hard. Huge adjustment for me. I did not make the adjustment well when I went to medical school for a variety of reasons. Was hoping to have an undergrad experience that I didn't have at UW-Milwaukee, and it didn't work. So I can tell you it's not very effective. So you really got to be ready to take these courses. So if you've been a non-science major, are you ready for a biochemistry course? Are you ready for a physiology course? That's really what I'm talking about. And then when you get to the summer months, these are our opportunities. So students can do research. They can do clinical opportunities, global health. So this is part of the curriculum that's a lot of fun. And it's great opportunities. And this is when students really expand their horizons. I can tell you another thing that our students do that get them into trouble. There are just a lot of great things to do in the field of medicine on this campus, great opportunities. And they'll sign up for all of them, you know, because they want to fix the healthcare system, learn Spanish, go global, run our clinics for the underserved, do all these things. Well, you know, you can't do 6 things well. You can do 6 things poorly, or you can do 1 thing well, you know. So it's really important to kind of have some priorities in order. In the second year, we go into the clinical kind of training years where they're really medical. So all these courses, I was talking to a student the other day about some of these courses, and everything that's taught in these courses, somebody will see in the clinical experience. Everything. And it's really hard as a student to sift through what matters, what doesn't, you know. And some students get really burned out. And if students aren't really healthy and taking good care of themselves, this kind of list is really a killer. I mean, it can really wear people down. So you got to really come in fit and healthy and deal with all your issues before you get here. Great courses. We're very picky. We try to make sure and our students do well on their big exams, but you got to be ready. It's not a sprint, it's a marathon. You know, you got to really be ready for that. In our 3rd and 4th year, this is pretty standard curriculum all over the country. Some people move around what's required or not. But these are kind of the clinical experiences. I can tell you when a student transitions to the 3rd year, they get through those boards, which is the hardest exam they will ever take in their life. There's no question. Step 1, it's a beast. It's so hard, I can't tell you. Students are well prepared for it if they put in effort. And when they hit these years, it's like the reward has come. They love their clinical experiences. They're doing one thing at a time. They're seeing patients every day. They're involved in decision-making. They're interviewing people. But it takes a really special person at that point. Because, you know, you come in as the low person on the totem pole. And it's about the patient. It's not about you anymore as a student. And it's really about how can we work together on this team. So I tell our students, if you go in and you say, how can I help this team deliver the best care possible? What role can I take? Students do really well. And if they do their homework. Great years, great experiences. On our campus, we're a statewide campus. Our students work in 15 different healthcare systems by the time they're done. Small rural community, large inner city hospital, academic center, group practices, referral clinics like Marshfield, La Crosse. So we get great experiences here. But medical school is really, really not like undergrad. You may see biochemistry, you may see genetics, whole nother level. So the one big mistake our students make in the transition is feel like, you know, I've done that before. I know how to do it. I'm going to just keep doing what I did before. I'll diddle around on social media 3 hours a night and do homework in between. It doesn't work that way. So every hour that a student is in one of our classes, they have to put in 3 hours of studying for that 1 hour. So it's a big volume. It's a 14-hour day, at least, for a student. So it's really, really different. So this is the why, you know. And a student I was talking to yesterday, we were talking about this cardiovascular, said, I'm really grateful for this course because my grandpa had a really bad heart problem, and now I understand it. Now I know what's going on, and when he asks me questions, I get it. And he said, that's such an amazing moment. He said, it was incredible. I just suddenly realized, wow, it's starting to pay off, you know. But to do that, he put in a ton of detail. So there's really a lot in there. You have to know 660 pages of clinical material. So the pace is really tough, And our courses in the second year are 3-4 weeks long. They just move. Taking 4 of them at once, 4 weeks later you shift again. So how do you do it? So I remember very well, as an undergrad, cramming was my style. I'd get in and stay up all night. I remember a couple exams I came in 10 minutes late because I was still cramming at 8 in the morning. Spent nights in that library, in the Memorial Library up in the cages. I don't know if any of you know about the cages, but, it's this depersonalizing experience with a bare light bulb and you're up all night. We didn't have Red Bull when I was a student. So that style, that's a great way to fail. It's a great way to do poorly in medical school. The students that really prepare and stay ahead, they read on the weekend for the classes coming up, so when they're in that class, they're listening, and the information, they're not hearing it for the first time. That's what they have to do. You really ought to study time management. It wasn't until I had graduated, became a resident, that I really had a course in time management. It made a huge difference. What are your priorities? What do you got to get done now? What do you have to get done today? What can wait 2 days? What can wait a week? How you think about those priorities, what's real, big deal. We've had a number of students, I can think of 4 in the last 3 years, that ended up flunking out of medical school because of how much time they spent on social media. One guy told me that he was so addicted to a war game, he spent a week straight on this war game, didn't do any homework, gone. Okay, so one guy flunked a couple of courses because his girlfriend in another state wanted to have him on Skype and watch him as he was studying and going around the apartment and doing all these things, 3 hours a night. So not going to work. You guys have a challenge that we didn't have, If I wanted to go find medical information, I had to come to the library. You guys can get on the internet and find billions of bits of information. And how do you synthesize that? And while you're sitting there trying to study, email pops up, Facebook message pops up, LinkedIn, it's just endless. So you guys have a big challenge. How you're going to manage that is huge in medical school, I can tell you that. You need to really be humble about that and be asking for help. And you might not know your learning style. I would submit you don't. Most of our medical students don't know their learning style, the best learning style. You should really be open to trying to figure that out. Because one learning style that works in undergrad may not work here. So it's really a big deal. So these are some tips that I really recommend. Think about how you organize. Think how you approach courses. Start doing that now. Work on your test-taking skills. Think about study techniques that really lead to retention. Because a lot of courses in an undergrad you can cram and dump and you'll never be asked again. I think it was Kyle that mentioned that, you finished undergraduate education. For a lot of people, it's like, I couldn't get a job with my major. So did you really have to retain anything from your 4 years? But you do in medical school. That needs to be retained. You need to keep this and build on your knowledge and experience as you go. So study techniques have to be different if you're really going to retain something rather than just passing a multiple choice test. And the biggies for us, most students come here, they do great. I have yet, in 31 years, I have yet to meet a student who wasn't capable of doing well here. But there are some students that I knew wouldn't do well because they didn't have other things managed. Their relationships weren't stable. They had underlying anxiety disorder or depression that they weren't treating. They were not taking care of themselves. Their family was in chaos. That kind of thing can really interrupt your education. So it's really important you think about those things. So besides learning how to study, think about balance in your life. It's huge. When you come, you go, I'm bringing my whole self to this education. I am here. I am ready. Now, the other thing I got to tell you is more and more, you really need to be excellent. I don't care what you want to go into. Sometimes students say, oh, I'm going into this, so I don't have to do that well. Really. But to get the residency you want, just like your colleagues who are trying to get a job out of their MBA or out of their PhD, if you want to go to the best place, you should strive for excellence. No doubt about it. If I have a student that's come in and just done their job, and I interview them all, I say, look, tell me why you struggled. And I tell the ones that do, tell me why you did well. This is what they're telling me, what I'm telling you right now. This is from our mouths of our medical students. If you set a goal that you really want to be excellent, you're going to have your choice of your career. That's just the bottom line. You know, it depends on what you want to do with it. So it's really about taking care of yourself. So we see a lot of students that struggle because of their health concerns, whether it's physical health, mental health concerns. So you got to take care of yourself. I had a student that in their third year ended up needing cardiac bypass surgery because they didn't take care of themselves. You know, it can be that extreme. So you really got to come and be ready. So this means that you've sat down with people that are in your world and you said, I'm going to be working 14 hours a day. There's times where I'm not going to be able to do things. How do we work out our schedule? How do we coexist? Mom and Dad, I can't solve your problems. Younger brother, I don't know, I can't get you out of jail. You got to lead your life. I got to lead mine. People don't, that's some of the issues that come up. So you really got to have people that are behind you. You really have to be really clear in your intentions, and you have to have any of these managed. So if you look at national data on medical students, about 40% have either underlying anxiety, depression, or another mental health disorder. It's very common. It's common in all our society. Just make sure they're managed well. The thing that drives me nuts about medical students, I'll be sitting and talking to them. They say, well, they think I have depression, and they want me to take a medicine, but I don't want it. I don't want to take a medicine. I look at them, I go, you're in medical school. I mean, we make medicines for, what would you tell a patient? So people have to take care of themselves. All right, it's really important. So the other thing is, I look back in my medical school, there's friends of mine from my anatomy tank and from my class that I see on a regular basis. We've been friends for 35 years. Some of them stood up in my wedding. All right, I stood up in theirs. And medical school actually is quite a bit of fun. You meet incredible, gifted, brilliant, fun people. And you can have a lot of fun, but it's got to be done in balance. So this is what I always told my kids. Have fun, but not too much fun. We have students have a little too much fun, get arrested, end up really putting a big dent in their career. It's really tough to recover from because there it is. So when you go to a hospital as a third-year student or you go to a hospital as a residency, they do a criminal background check. They find out what you've been arrested for. And if you did something stupid as an undergrad, they'll probably forgive it. If you stole something when you're a medical student from a hospital, you're not getting a job. That's what happens, So it's really important to do this. And in our campus, this is a huge deal. It is a really huge deal. And it's one thing when a student gets ejected from the student section in your undergrad. It's a whole other thing when a student gets arrested and ejected and they're a medical student because it makes the paper. And it's a whole other thing when medical students do something bad on campus because I'll tell you what, undergrad gets drunk, does something stupid, no news. Medical student does something stupid, news. That's what happens. I can tell you because they go, future doctor does X. Okay, so it's really important that people come and they go, I'm stepping across the threshold. I'm entering this profession now. That's what we expect of our students when they come here. It's not easy to do, I can tell you. And the other thing is overcommitment. So our students are so excited and so good and so ready to solve really big problems that they want to do it all at once. And I always tell our students, this organization doesn't want a lousy medical student. They want a really high-quality physician. So get the training done first. Get your education, and then save the world. Because I think a lot of our students are going to do that. But they sometimes get the cart before the horse. So it's really important to do this carefully. And it's important to come and be ready for graduate school, for professional school. This is what can get you in trouble. It's what got me in trouble, I can tell you that. I was hardly spotless here when I was a student, but I wished I'd thought more about this. So it's really about, are you really here for the right reasons? The other thing is that a lot of really bright people aren't willing to ask for help. And there's a lot of great resources in a medical school because we know how challenging it is. And all of us have been through it. Great resources. And students will wait till the last second when they're hanging by a thread to ask for help. Really bad idea. Smart students come in and say, here's what kinds of things I'm going to deal with. I'm going to go introduce myself to these people so that I can work with them and be prepared and be ahead. That's a really mature, dedicated student that's really thinking ahead, not wait until they're in crisis mode. So this is really, really important. And the other thing to remember as you think about it is this isn't about you. It's about sick people. And it's about healthy people trying to stay well. It's about your communities that really need health care. And a lot of times medical school is so isolating and so intense, that the students think, well, I want this and I want that, and they're not teaching me when I'm over at the hospital, and they're, Guess what? Priority when we're in the hospital is the person that we're serving, okay? And the students sometimes come later. So we have a major commitment to teaching in our clinical environments, but it's pretty hard when we're doing an operation or we're doing a procedure or we're seeing a patient and we're really intense about it. It's not about did we put learning objectives together for somebody in our clinic. So, it's you come in and you say, okay, I'm giving myself up because I know when I get done with it, I'm going to be in a place where I can deliver really, really good care. And so we make a big point of that in the school. The patient comes first. Challenging, I can tell you, in your busy lives, that'll be a big challenge. The other thing that's really important for you to think about, one of my favorite quotes, it's by a famous guy in mythology named Joseph Campbell. And he said you can summarize up all of human wisdom and mythology in this quote right here, follow your bliss. So if it makes you happy, you're going to be much more engaged, you're going to be much more dedicated, you're going to be crawling for more information, I love reading medical journals. So one thing that my wife claims that happens when you go to medical school is you become a geek, so she calls me a geek. But we love new data, love new information. And so that's blissful. If you come here and you don't like it and it sucks and you're miserable, don't do it. There are lots of ways to help people. We have students that think you have to be a doctor to solve problems, nurses, pharmacists, PTs, OTs, healthcare systems professionals, MBAs. There are a lot of people working problems. So do what makes you passionate. It's so important to decide about this. So for us, just to give you an idea about how we help people through those challenging times, this is what our students say about us. They say we have faculty that are really accessible and helpful, and we have a supportive environment. People work together, collaborate, try to get you through this experience. That's my commitment to our students is you work with us, we'll work with you, and we'll get you through this challenging time. We've got great support staff. We've got great resources on our campus, and we're one of the world's best universities. That's pretty tough to beat. That's what you want to look for, I think, in a place where you're going to get your education. We have great facilities here, as you'll see, those of you that are visiting us. Think about that when you're in class. So last week, we had this homecoming weekend. One of my classmates donated a classroom upstairs to the school. Our school is just a little over 7 years old. It's beautiful. And I went up there, and the door is all full of slams and nicks. Somebody has been slamming the door open, and there's all these marks in it, and there's crap in the room, and the room looked like hell. So I had to quick call the facilities people to get it cleaned up. These are gifts. This room is a gift to all of us, and we really got to take care of it. So if you have the opportunity to study in our library, which was donated by the Ebling family, or be in here, value it. This is extraordinary. There aren't facilities like this anywhere in the country. So we're really fortunate, and we have really supportive alumni. Over 1,200 of our alumni in the state of Wisconsin take our students into their practice and teach them in their health system and practice on a volunteer basis. So it's an extraordinary place, Wisconsin. And the other thing is don't get ahead. This is a journey. There's no doubt when you're doing 7 to 12 years of training, it's definitely a journey. You don't get to there first. And so just take one step at a time. Do the next right thing. Do the thing that gets you best prepared and clearest about what your intentions are about medical school. So I want to thank you very much for your attention. I want to leave some time for Dr. Remington, but I'd be happy to answer any of your questions about medical school or the experience. So thank you all very much.